Hello. Testing. Testing. Good morning. Today is Saturday, August 14th, 2021. This is our schedule, Saturday morning yoga therapy class. Last few weeks, I've been busy with a multiple presentation, and also we're in a process of shifting our residence, but we are still in the same house. Some work is going on in the house before it is being put in the market. So I just in a different location. But today's topic is yoga therapy, the transformative power of lifestyle medicine. First, we all talk about lifestyle. What is a lifestyle? What is a lifestyle medicine? What is the state of lifestyle medicine? And what is the transformative power of yoga therapy? You all know yoga is an anglicized word from the original root word called yog, which means union of your body, mind, and spirit. It's a philosophy. It's 196 sutras, small aphorisms, of which 193 is to quiet down your mind. The practice is 8 limbs yoga, Patanjali Ashtanga Yoga, and ultimate outcome is your meditation, 7th limb, and Samadhi is the 8th limb, which is union of your body, mind, and spirit. It is primarily relaxation response and activation of parasympathetic tone. It is a daily routine and it is a lifestyle. So what does our lifestyle has to do, and what is the lifestyle medicine? When you go back on our life, we're very calm, we're very relaxed. We almost have no lifestyle related disorders. Number one cause of death was either a infection or a trauma, or if it's senior people falling down. But when you start moving to a different location, in Sanskrit is called aprabhashi. Prabhashi, when you move, then you lose all of your ease. Dis-ease in Sanskrit is called ashuk. So what is the losing of the ease? Losing of the ease is basically a fear of unknown. Came to this town, I don't know what is going to happen to me. I'm going out in the street, whether I don't know whether I'll be able to cross the street, or my children going to school, whether they will get involved in a mass shooting. I'm in a plane, or the plane will be hijacked. It is a constant fear of unknown, which literally we call it a stress. So it's a stress-related disorders, which is also primarily called activation of your emotional brain called a limbic system. There are two nuclei called amygdala and hippocampus, and primary activation of sympathetic tone. So a high sympathetic tone, which causing all of our lifestyle related disorders, and yoga therapy is the activation of parasympathetic tone. So what is the root cause of this stress is your insomnia and sleep apnea. Not able to sleep and waking up middle of the night because of apnea, which is called sleep apnea. And it creates a cascade of phenomena. Insomnia and sleep apnea causes activation of your limbic system, primarily the amygdala and hippocampus nuclei. Then they subsequently send a signal back to hypothalamus for homeostasis. Hypothalamus sends a signal to your autonomic nervous system to balance the high sympathetic overdrive and rapid shift to the parasympathetic tone, and also activation of pituitary gland, the master endocrine gland called pituitary adrenal cortex circuit, and controlling the high output of your cortisol. So in your insomnia and sleep apnea, you get the high sympathetic tone and high cortisol level. This cortisol, the hormone, then converts our excess sugar to a fat which is called omental fat. Omental fat means fat inside the abdomen. We call it a truncal obesity. General obesity is not that much of harmful from medical standpoint than the truncal obesity. This omental fat then starts secreting inflammatory molecules called pro-inflammatory molecule inflammation. Inflammation causes then cascade of events, which is called diabetes, hypertension, coronary artery disease, or you call it atherosclerotic heart disease, or you call it heart attack. Then called dyslipidemia or a high cholesterol. Dyslipidemia is a high your triglyceride, low HDL. HDL is a good cholesterol. And it has a lot of other components, but primary component starts here called truncal obesity, and primary component starts here called insomnia and sleep apnea. So let's see what yoga can do for us. On the other hand, the lifestyle medicine is being here for some time. That is called American College of Lifestyle Medicine, which was established in 2004. They use the same information of your integrative medicine and try to correct, oh, this is your diet, this is due to your lack of sleep, this is due to your stress, we are going to all this. But remember, when you have a stress, the comfort of the stress is called a comfort food. And comfort food is nothing but high calorie laden fatty food. So the consumption we do, what we call is the food which is not good for us. It's a comfort food based on our underlying stress. There is a tremendous study, even in the rat model. There are two rat models. One rat was always giving a stress, like they're always being poking and causing a fear. And another is a very calm, quiet rat, and they're given a food. Which food they go to? The rat which is stress, go to sugar, go to the fat, go to the high calorie laden food. Remember, all these foods are also good for us. We need all this food. So what is our biggest problem? You all know. We eat too much. Our portion size is too big. The moment you cut down your portion size, it really doesn't matter what you eat. And then your digestion is the primary, is called a parasympathetic tone. Parasympathetic tone is called calm and digest. So let's see how we create a parasympathetic tone. The first creation of parasympathetic tone is a relaxation response. Relaxation response comes from able to stay in a pose for a long period of time with a completely effortless breathing, exhalation longer than inhalation. So if you're sitting in a chair, I sit in a chair, first thing I do, keep my spine straight. The moment I keep my spine straight, remember all the muscles in the back are holding me, keeping me straight up. And that muscles in a tight, I can feel, these are like a two, what do you call, a tight, like a two blocks sitting here. But the moment I keep my spine straight for a while, now I can feel it's like a two pillows sitting here getting softer, spine straight. Then able to activate your both side of your brain. Say, I was sitting like this. Now I'm going to go and sit, crossing my feet in the opposite side. We are all lateralized. I'm right-handed, right-footed. I'm only using my left brain. Able to activate both sides of the brain is going to bring your relaxation response. Then you do your hand, called hand mudras. Mudras are the hand gestures. Hand connects between your body and mind. We all talk with hands. When we're talking, we're using our hands. Our hand moves before our tongue. Our brain, cerebral cortex, half of our brain controls only two hands. Isn't it amazing? 1/4 of the brain controls our head and neck. Then another 1/4 of the brain controls the rest of the body. So touch your index finger and thumb. This is called your meditation mudra, Gyanu mudra, Dhyanu mudra, and you will see your mind is going to quiet down and relaxation will set in. So the relaxation will set in very easily. I'm sorry. Something is happening here. Let me see. Okay, I'm back. This computer thinks, it always comes up. So you have the moment you keep your hands under control, your mind quiets down. As simple as it is. Let me see what happened here. Okay, I'm sorry, I'm back. Some technical issues. Okay, so able to sit down in a posture. Always remember the asanas, there will be no pain. If you get a pain here, back off. Find a place where you're comfortable. Hand mudras. Then what creates our mind to be active, you have to quiet down the mind to get the relaxation, is the five senses. I see, I hear, I smell, I taste, and I touch. And the most powerful of our senses is our vision. Eye is the extension of our brain. It connects directly to our brain. Close your eyes. Now you pay attention to your breath. Lung is like a balloon. It has a 6-liter capacity. We need 1.5 liter to keep the lung open. It's like a balloon. Then you have a 4.5 liter, which you can exchange, which is called your vital capacity. Normally, we only exchange 500 milliliter, which is a half a liter, which is called tidal volume. So you have almost a 4 liters of reserve. So it's a balloon full of only toxic carbon dioxide. So you learn how to breathe out first. Slowly take a deep breath in. And learn how to breathe out longer than breathing in. One observation I want to share with you. See, I've been talking to you for some time. My mouth is still wet. Mouth has a lot of saliva in it. What it tells you that I'm having a parasympathetic activation. The salivary gland is supplied by parasympathetic nerve. So when you're fearful, when you're stressed, you get a dry mouth. My mouth is wet now. So again, try. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. You continue this and you start exactly without any effort. So whatever level you can do 2 seconds in, 4 seconds out. Slowly you will see, we'll go to 3 seconds in, 6 seconds out, 4 seconds in. We are doing it so long, we can do it for 10 seconds in, 20 seconds out. The muscles of respiration are called skeletal muscles. They can be trainable. They can be trainable like I'm doing my weight training and I can start with a 5 kg, then I can go to 7 kg, then I go to 10 kg, then I go to 15 kg. It's very easy. By days, the breathing will get better and better. See, even you're sitting in the same, you will see you're so relaxed. Now we can go and see if we can go back. It's called a Siddhasana, stuff pose. You put your one foot in the top, you'll see your knees drop down because you're relaxed. If it is not there, if it is there, let it be, stay here. Don't push it down. If you push it down, it'll come back high up. It's down here. Now we incorporate another mind control. Mind is the 5 senses. Our brain has a frequency. You create another frequency. 2 frequency interacts, cancels. It's called harmonic resonance. It's called a bumblebee breathing or Brahmri Pranayama. So remember, yoga therapy, you are using the same tools. You're using the same, your yoga sutras, the aphorisms. You're using same 8 limbs, but you learn how to use them. Proper adaptation based on the patient's clinical condition. And you see, I'm using asanas and pranayamas, mudras, meditation all together to get the powerful relaxation response. So let's try about a couple of Brahmri Pranayama. Put your index finger in the forehead. Use your 3 fingers to close your eyes and thumb to close your ear. We can always also close, it's called a Shanmukhi Mudra. You'll be doing all the breathing through your nose. Breathe out first. Take a deep breath in through your nose and breathe out with the sound of a bumblebee. Breathe out first. Take a deep breath in. One more time. Breathe out first. Deep breath in. Then the pumping and cupping is a wonderful relaxation. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, take both the hands, put it over the eyes like a cup. Let the eyes take all the heat from you. Then massage your forehead, massage your eyes, massage your face, massage your head and neck. It's a wonderful relaxation response. Once you have this relaxation response, now you can feel the effect of it. You can see. I can go and see, put your 1 foot high up. It's like a half lotus. You can sit down very comfortably in a half lotus. Absolutely no problem. I'm very comfortable. I'm relaxed. And I can stay here. To bring the relaxation, you need to place probably between 5 to 10 breaths, maybe 10 to 15 breaths, completely relaxed and a calm and quiet. To the opposite side, got a half lotus. And you see, you are going in stages, and we say in stages, impossible become possible. It's a wonderful yogic statement. Come back again. Get into a lotus pose. Padmasana. You feel so light, so comfortable, you can do, which is called, you can lift yourself up, called Tadasana. Put your hands here, push it down, your whole body will go high up. You don't even feel the weight in your body. Feel the lightness your body and mind, and that is the power of your relaxation response, counteracting lifestyle-related disorders. People always ask me, I have diabetes, what should I do? I have hypertension, what should I do? I have a heart disease. I said, you do, I will tell you what to do, but basically you start a relaxation response, start a practice when you will see your mouth having a saliva, you will be definitely know that you are hitting the right path. So, in this situation, say, once you achieve that, you can look for a few other asanas, which are very wonderful relaxation and activation of parasympathetic tone. And remember one thing, once you activate parasympathetic tone, what happens? Your digestion or the whole digestive system is your parasympathetic tone. Say for diabetes. For diabetes, can you give me one time? I'm seeing there's some problem here on the transmission. I'm sorry again. No, it's okay now. Yeah, I started after a few days. Okay, so diabetes. Yoga thinks diabetes is body not able to digest your sugar. So you create a relaxation response for the treatment of diabetes. It comes from your this truncal obesity. So you do a pranayama called Kapalbhati Pranayama, which we'll do it soon, and you will see that will be treatment of your diabetes. Heart disease is due to tightness of the coronary arteries. We call it an endothelial function. There's an inner lining of the coronary arteries. When endothelial function is there, it secretes a substance called nitric oxide. Nitric oxide is a powerful, powerful vasodilator. It opens up the blood vessels. Same way when you breathe through your nostril, the mucosa in the sinuses secretes nitric oxide. So nitric oxide is our total body's health, endothelial health. When the whole body has a relaxation response, your blood vessel relaxation response. A powerful relaxation response is a Thunderbolt pose or a Vajrasana. So when you sit in a Vajrasana, essentially you start in a stages. You can start sitting on your heel first. And if you have a little issue, you can put a little bit of a rolled towel underneath. I like a rolled towel because slowly you'll be able to take the roll off. Slowly go back down and able to sit down and keep your spine straight. This is a therapy for lifestyle-related disorders. This is a therapy for proper digestion of your food. When the food is properly digested, it converts into 7 tissues. We call it Saptadhatu. Plasma, Rashadhatu. Red blood cell, Raktadhatu. Muscle tissue, Mamsadhatu. Fatty tissue, Medodhatu. Bony tissue, Ostidhatu. Nervous tissue, Majjadhatu. Reproductive tissue, Shukradhatu. Then they converts into a substance called ojas. The ojas is our body's immune system. Once your immunity is high up, it protects you. So what happens in a practice of the relaxation response also improves your immunity. And the lifestyle-related disorders, activation of sympathetic tone reduces your immunity. So with the present day, COVID-19, your immunity gets better, you'll be able to fight the COVID-19. Next one is a wonderful practice. It's called your Mundukasana. You do the Mundukasana. You can put your one hand in the cup. Deep breath in, slowly breathe out. Slowly suck your stomach in and look straight high up, see if your body comes down. How far it comes down, you watch it and stay here. Keep breathing, breathing out longer than breathing in. This is the treatment for diabetes. Treatment to massage the omental fat. Yoga says more you massage your omental fat, more you massage an organ, it gets better and better. So every relaxing asanas you do, you want to stay. See, I'm here staying in the pose, and then I'm so comfortable, I'm talking. I'm even singing in that pose. That is more important. And that is the bottom line for yoga as a therapy. Vajrasana, Mundukasana, it's a wonderful relaxation. Vaisasana. Vaisasana is another wonderful relaxation. Vaisa is like your buffalo. If you see the Vaisasana, what Vaisasana do? They put your one knee in the top of the another one. Then it will continue as a called Gomukhasana or a cow face. And literally, if you look at it, it will look like a cow face. So this is the relaxation of the lower extremities. What I do, I sit down like this. I close my eyes. I do my breathing. Breathing out longer than breathing in. Exhalation longer than inhalation, and I feel more and more comfortable. Same way, I'll slowly switch my, so I can do it very quickly, very rapidly, but that's not yoga. Yoga is that listen to your body's signal. If I get a pain here, I back off. It has to be pain-free and has to be with a completely effortless breathing. So here I am. I'm using my other foot in the top. Remember, activating both sides of your brain. My whole upper body gets relaxed. Tadasana, called your prayer pose to the back. Paschim Namaskar. Then you get your neck. Neck get relaxed with a 4 movements of the neck called Brahma Mudra. Then you incorporate the prayer pose to the back, movement of the neck, and with a bumblebee breathing, that will be the relaxation response. And also when you're able to do a cow face called Gomukhasana, you are completely, lower part of the body, upper part of the body, the whole body get completely relaxed. Let me turn around to show it to you, what I'm saying, and then we'll do the practice again, and you'll be feeling the effect of it. And you can do it if you are practicing with me. Okay, here it is. I have my left knee on the top of my right knee. So slowly I start with a prayer pose to the back called Paschim Namaskar. I put my hand here and start where you are. If your hand doesn't come here, if it is, stay here. Slowly and slowly it will come here. When it comes here, slowly see if you can This is a tremendous transformative power. It transforms a people with disease called rogi into people with no disease called nirogi. Then a person who is enjoying health is called a yogi. Rogi to nirogi to yogi. I'm talking to you because I want to hold into the pose. I'm holding into the pose, I'm talking, I'm singing, my hand is going to go high up. More and more I'm relaxed, higher and higher my hand goes high up. The people who are suffering from a lifestyle related disorder now more are your people working in the IT, information technology, sitting in front of that screen, the computer. I tell them, take your hands off and use the prayer pose to the back. Wonderful practice. And let me show you the most therapeutic asana for the lifestyle related disorders is your whole relaxation of the lower body and upper body, which is called your Gomukhasana, cow face. My left knee is in the top of my right knee. My left hand goes high up. I put my right hand to the back. Then I stabilize my right hand. I put my right hand in the middle. Use my left hand, bring it down. I hook it. I literally close slowly so that I will be able to even handshake both the hands. Staying in the pose, closing your eyes, and able to breathe effortlessly, breathing out longer than breathing in is your therapeutic yoga. How long? As long as your body will allow you, without any pain, without any discomfort, but little discomfort. We call it comfortable discomfort, and essentially effortless breathing. If you're comfortable, stay here between 10 to 15 breaths. It's a wonderful practice. Now I'm going to switch opposite side. Now my right knee is in the top of my left knee. And I wait a little bit. See the relaxation response to set in. Your beautiful breathing, longer exhalation than inhalation. Right hand goes high up first. Left hand is here. I take the left hand, put it in the middle, in the center. Take the right hand, put it down, touch it, hook it, and essentially you handshake each other. So able to do it equally on both sides. That is your balance. It's a wonderful practice. Remember, all the people talks to me said, I want to do some pranayama. Pranayama, breathing, voluntary regulated breathing is a therapy for all the lifestyle related disorders. You are already doing pranayama here. You're removing all the carbon dioxide, bringing fresh oxygen, exhalation longer than inhalation. Cannot have any better practice than this. And ultimate relaxation, you can sit down in a chair, you can sit down here comfortably. This is Sukhasana. The word is called easy pose, Sukhasana. Sukhasana, slowly put your hands to the back. Do a prayer pose to the back called Paschim Namaskar. And wait here a little bit. See how high is the hand goes high up. I always say when you practice yoga, you have to be smiling. It'll be totally effortless ease. Shuk. When you do the yoga with your, with your frowning and all the muscles in the face are twitching, that's not yoga. That's your putting a lot of effort yourself. Neck movement. The four neck movement is called Brahma Mudra. You put your neck to the back. You can do with your inhalation and exhalation, like you breathe out first. Take a deep breath in, slowly drop your head to the back. And breathing out, slowly bring your head down. Breathing out, and find this posture. If you feel any pain, you back off. If you don't have any pain, you progress, then you listen to your breath. Your breath is not interrupted. Come all the way down. This is also called your chin lock. And slowly come back higher. The four postures, you do side to side, then look to the back, and then turn your neck. But you can do also with this your bumblebee breathing. With that frequency, you extend your exhalation, your brain quiets down, your eyes are closed. It's absolutely a wonderful relaxation response. So breathe out first. Take a deep breath in and slowly drop your head to the back. And breathe out with the sound of a bumblebee and drop your head in the front. If you're practicing with me, you'll be noticing that your exhalation becomes longer with this bumblebee breathing. Try one more time. Breathe out first. Take a deep breath in and put your head to the back. And breathe out with the sound of a bumblebee. Do side to side. Breathe out first. Deep breath in. look all the way to the back without turning your shoulder. Finally, rotate to your neck, to the left, to the back, to the right, and from right to the back to the left. Same way. Breathing out first. Deep breath in. Now we do pumping and cupping. Take both the hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, take both the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your ear, earlobe, behind the ear, in front of the ear, inside the ear canal, like external auditory canal. It is called a branch of vagus nerve, auricular branch of vagus nerve. It activates your vagus nerve. All the muscles in the face are attached to your skin. So when the muscles are relaxed, all the frowning goes away. All the lines in your face goes away. Slowly bring your hands, massage in front of your neck. This is called massaging the carotid sinus, both sides of your neck. It activates your parasympathetic tone. We do carotid sinus massage when heart rate goes high up, called supraventricular tachycardia. Goes to the back, massage to the back. There's the insertion of two muscles called trapezius and sternocleidomastoid muscle. Both are supplied by the cranial nerve. The cranial nerve, the nerve comes from your brain and keeps your mind very calm and relaxed. Next relaxation is a wonderful relaxation, is able to sit down in a squatting pose. If you're able to sit down in a squatting pose, look at that. It relaxes my ankle, relaxes my knee, my hips, my back, and then it's called malasana, squatting pose. Then take your hands, separate your fingers. This is the way hand gets relaxed. Extend your wrist gets relaxed. Put one elbow inside, other elbow inside. Slowly bring your hands close to your body. Keep your spine straight. Keep your eyes closed. Breathe out longer than breathing in. You do 8 to 10 breaths. I wake up in the morning. First thing, I sit down in the squatting pose, drink a glass of water, sit down for a while. Within a short time, I get urge for a bowel movement. I get a good bowel movement first thing in the morning. Next is a powerful relaxation. You'll be able to get up without a support. If you can get up without a support, it is a wonderful phenomenon. Okay, let me just move that camera a little bit. So you'll be able to see me better. So when you're able to get up, this is a very wonderful yogic relaxation practice. Able to sit down without support and get up without a support. Then what you do, you practice your balancing. We are comfortable standing like this, our feet parallel to our shoulder. So you put your feet together. So how comfortable you are now. This is called your Tadasana, stick pose. Your ear, your shoulder, your hips and the ankle in the same line. If you go against a wall, your body will be exactly touching the whole wall. So asanas, which are relaxing asanas, you are practicing for the lifestyle-related disorders. If you can go slowly, cross-legged, called Sukhasana, easy pose, Siddhasana, perfect pose, half lotus and a full lotus, Padmasana. Thunderbolt, Vajrasana, Mandukasana, able to sit down in a squatting pose, Malasana, able to get up without a support, and able to sit down with your spine straight. Always walk with your spine straight. Then if you want to do a little bit balancing, you can cross your feet. So if you're crossing your feet, you can sit down crossing your feet and get up crossing your feet. These are the sign of health. By the time you get the sign of health, the disease get corrected. Here it is. Put it again in the opposite side. Sit down, cross-legged, and you can get high up. Finally, what you're able to do it, what really transforms you, the transformative power of yoga, that able to sit down on the ground and able to get up from the ground without a support. Initially, it looks like almost impossible, but you'll be able to do it. See, here I am. I'm in the ground. I'll be able to get up without a support. See, in stages, impossible become possible. Age is not a number. We used to call, my phone number. A long time back, we used to say, my number is unlisted. My chronological age, the number of years I'm carrying, is my unlisted. What is my age? It is my mental age. It is my physiological age. Sit down again. Crossing your feet, opposite side. Always use both sides of your brain. In the morning, use the left hand to brush your teeth. You will see the difference. Initially, the brush will be all over. By the time you brush your teeth, you'll say right hand moves like this. This is called neuroplasticity. Brain get used to the way you perform. I was electric shaver. I use my left hand to electric. I always use my left hand. With always being using my right hand. So here I'm sitting down in the ground. See if I can get up without a support. We call it a money back guarantee. You're able to do this, your lifestyle related disorders will be transformative. You will have fundamentally three things. You'll have a better quality of life. You will have a reduction of the pharmaceutical support. If you're taking X number of pills, you will see number of pills will be coming down, whether it is diabetes or hypertension or a heart disease. Then it's prevent the progression of this chronic disease or even reversal of these chronic diseases. Next, you practice again balancing poses, activating both sides of your brain. So we don't do the pranayama standing up. Pranayama causes altered sense of consciousness. So let's see, do the pranayama sitting down or laying down. We'll do pranayama practice maybe next week again. But today I want to show you these asanas. Remember, these asanas are, for me, it's a meditative asanas. See, I'm having my saliva in my mouth. I'm in a state of meditation. I'm in a so relaxing response that my breathing becomes effortless. I get into the fifth state called your pratyahara, controlling your five senses. Dharan, focus. I'm in focus. Whatever I'm doing, I'm in focus. Dhyan, meditation. Quieting down the chattering of my mind. So when you fall down, always fall down in a hand. When you fall down with an outstretched hand, it causes a fracture called a Colles fracture. Fracture of the wrist. Take your hands up, put a prayer pose to the back, or you can hold your one hand, it is called your Paschim Baddha Hastasana. That means holding your hand. You hold your left hand, take your left hand, put over your right forearm, and hold your right arm. I'm right-handed, right-footed. See if I'm able to stand on my left foot. I'm standing on my left foot. I'm counting. 5 seconds, 10 seconds, 20 seconds, 40 seconds. When I can able to stand for a longer time, let me see if I can close my eyes and I can stand by one foot. Initially became almost impossible, but essentially you will be able to do it. My eyes are closed. I am standing on my one foot. By the time you can do this, as I always say, these are called money back guarantee. Change your hand again. Activate both sides of your brain. I'm holding my right arm first. Take my right hand over my left forearm. Hold my left arm. Let's see if I can stand on my right foot. You'll see your one foot is always little more comfortable than the other because one side of your brain is always active. Again, 5 seconds, 10 seconds, 20 seconds, 30 seconds, 40 seconds, then my eyes are closed. My eyes are closed. I'm standing on my right foot. Initially, as I said, it becomes almost impossible, but you'll be able to do it. One thing you'll see when you can do a Kapalbhati Pranayama called breath of fire, we really don't do it standing up, but what it does, it shows you that your muscles are whole, very relaxed. You can do your, say, tree pose. But when you put your hands in the back and hands in the front, makes a lot of difference. If you put in the hands in the front and put your feet in the below the knee, put it above the knee, and get into tree pose, you have a different balancing than when you put your hand to the back. When you put a hand to the back, you'll see you'll have a lot more balancing. And then here, to check your relaxation, you can do few Kapalbhati Pranayama. Wonderful practice. And these are called, you remember, it's called your experiential yoga therapy, and then it's called the experimental. Experimental means your individual personal practice. Doing it again. Opposite side, doing Kapalbhati Pranayama. Next, always try to practice head below your heart. When you put a head below your heart, your pressure inside the brain goes high up, called intracranial pressure. Pressure inside the eyes goes high up, called intraocular pressure. Pressure in the carotid arteries goes high up, and you feel miserable. You cannot talk, cannot breathe. But if you stay in the posture a little longer and longer, and if you get into stages, all the pressure normalizes. It is called your baroreceptor sensitivity. And that's how you control your hypertension. So we control your heart disease. It acts like your beta blocker. It acts like your ACE inhibitor. So wonderful, wonderful physiological changes. And remember, here it is. I have this Apple Watch. I'm wearing it all the time when I'm practicing. I have all my health parameters here. And as you all know, Apple Watch becoming now the health tracker. We have other things too. We have a Fitbit, we have a lot of other in the market. And this one I can get all the information on my cell phone. Prasharita Uttanasana, separated head down to the front and able to do a Kapalbhati Pranayama in that asana. Slowly, I'm separating my feet and I have a head. It is called supported forward bend. And I don't go down in one day. Even if I'm in the yoga studio, somebody is following me, I listen to my body's signal. No pain, effortless breathing, go a little bit further down. I don't have any symptoms. I still feel very good. Still can talk, still can breathe. Put my hands down, slowly separating my feet as far as it goes. Get my head all the way down, put my head in the ground. Hold both the feet, and I will be able to do a Kapalbhati Pranayama here. I do it every single day. I do it a lot more. Sometimes I do 300, 400, 500 of this. It massages your pelvic floor. Excellent for men with prostatic hypertrophy, benign prostatic hypertrophy. Women with a pelvic dysfunction. Let's go ahead and show it to you. And today I'm going to finish with showing you about your insomnia, how to sleep. For a sleep apnea, you do Ujjayi Pranayam. You do Ujjayi Pranayam, and along with Ujjayi Pranayam, you do a Jalandhar Bandha, chin lock, and left nostril breathing called Chandra Vidhi Pranayama. We'll do pranayama practice next week, but now I want to show it to you how you can overcome your insomnia and how to sleep. How to sleep the way the yogis sleep, and even how I sleep. And I sleep this way every single day. You know who sleeps better? Who sleeps well all the time? Babies. So what you do? You sleep like a baby. How do you sleep like a baby? If you see a baby, how they sleep, so first you lay down on the mat. Try to be sure that, okay. Try to be sure that your chin is not too high up. If the chin is too high up like this, it creates a sympathetic response. So what you do, if you are like that, you can even put a little bit of a folded blanket and use your hand and both sides, about 6 inches from the side. See if your thumb can touch the ground. Close your eyes and use the power of your breathing. This is what is Savasana. When you do abdominal breathing is your relaxation, parasympathetic, thoracic breathing is improving your chest function. But then when you see a baby, see how baby sleeps. Baby will bring both the feet together and sleep like this. This is called Supta Baddha Konasana. You will watch. I watch my grandson all the time. That's where the baby sleeps. If you cannot sleep, put like that, you can put 2 pillows underneath your both the knees, get supported. Then what you do, use your hand. This is called Adhi Mudra. It's like a baby fist. If you do a baby fist, baby will have a fist, thumb inside and close. Thumb inside and close. Put it on your body side. Bring your awareness, your breath, to your abdominal breathing. So these are the stages. Remember, sleep. 2 types of sleep. REM sleep, rapid eye movement, and non-REM sleep, non-rapid eye movement. In rapid eye movement, sleep is almost 25% and non-rapid eye movement 75%. Rapid eye movement, your mind is still active, you dream in that, and your body function doesn't go down. Non-REM sleep has 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 has 50% of the sleep. Stage 3 and 4 is the deep sleep. And in the stage 3 and 4, all the repair in our body and mind takes place. If you go to bed and fall asleep, you are sleep deprived. People always ask me, how do I know I have insomnia or sleep apnea? Daytime sleepiness. If you feel sleepy in the daytime, you did not sleep enough last night. And it's not how many hours you sleep. What is the amount of time you had a deep sleep? Most of the sleep tracker, including the Apple Watch, has the sleep pattern in the deep sleep. Incorporate abdominal breathing. In abdominal breathing, when you breathe out, abdominal wall goes in. Breathe in, abdominal wall will rise high up. Breathe out, wall will go in. Breathe in. Breathe out. Do it a few times. Remember one thing, sleep has a lag time. You fall asleep after 10 minutes. And if you don't fall asleep after 30 minutes, you're having insomnia. People also ask me, I wake up middle of the night. I'm in my age group, my prostate wakes me up. It's no problem. If you wake up, you go to the bathroom, you come back and fall asleep. If it is within 20 minutes, that counts as your sleep. The sleep never gets interrupted. Somebody said, wake up twice a night. Okay. If you go to the bathroom and come back and fall asleep again within 20 minutes, your sleep cycle continues. It's a wonderful practice, abdominal breathing. Next, what you do, you can keep your legs straight or keep it in this Supta Baddha Konasana the way you like. Now you practice breathing out longer than breathing in between 5 to 10 times. Then you practice breath holding. And you will see when you do this thing in sequence, not in first day, not in second day, not in third day, but slowly and slowly you will see you will fall asleep right away. All these things you do, shut off your cell phone, shut off your iPad, the computer 2 hours before going to bed, take a shower, do all these asanas, don't eat any coffee, don't eat a big meal before 3 hours, After all these things, people are still having insomnia. I see it all the time. People call me. Insomnia is the root cause for this lifestyle-related disorder, which is called metabolic syndrome. Now you see, when you do these practices, these are guaranteed to bring the sleep. Sleep like a baby and sleep like a yogi. I'm doing a sleep like a baby now. Baby, you see, when the baby is sleeping, baby's stomach will go high up with the breathing in and will come down. Now do breath exhalation longer. I will do breathing in for a count of 5 in, breathe out with a count of 10. Generally, I do 5 to 10, but I show you a couple of times. Breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10. One more time. Breathe in with a count of 5 in. Breathe out with a count of 10 out. Continue this thing about 5 to 10 times. Next, you do the breath holding. Breath holding ratio is generally 1 to 4 to 2. You can, many a time, you can separate your feet until the width of your mat. Have your one hand, your baby fist, called Adhi Mudra, or called a Balu Mushti Mudra, like a baby, the way baby closes the hand. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. Now I can increase a little bit more. I've been doing it for a long time. I can do it. Breathe in with a count of 5 in. Hold your breath for count of 20. Breathe out with a count of 10 out. Then what you do is sleep like a yogi. Yogis first sleep on their right side. And the way they will sleep on the right side, they'll sleep on the right side. They will be in a fetal position. Like bend their knees, they put the head of the hand, and in this way what happens, your left nostril opens up. Initially, your body core temperature is high, but when the sleep gets deeper and deeper, body core temperature goes down. And in a deep sleep, all the muscle relaxes. So initially, to bring the balance when a body core temperature is up, left nostril breathing is cooling. It is going to cool it down. So initially, you stay in the right side for some time, and once the body's internal physiology gets balanced, then slowly turn around and sleep on your left side. Yogis don't have any pillows. They put the hand like this and sleep like this. I've been doing it for a long, long time, and it's a wonderful way to sleep. And in this posture when you're sleeping, but many a time I can put a small pillow. I put this pillow and put my hands here. It works fine. Now we look at what the physiology of the left-sided sleep. My blood return to my heart, main vein, it's called inferior vena cava. It comes from the right side and is coming to my right heart. And there is no compression, and I got an excellent venous return. I get a both good preload for my heart. I'm very relaxed. My afterload goes down. I'm in a profound level of relaxation. Now my right nostril is open. Right nostril is your Surya Nadi, sun energy, sympathetic, and is heating. My core temperature is down in my deep sleep, and the cool temperature inside getting balanced with the right nostril breathing. And this is the way you sleep the rest of the night. Wake up in the morning, you'll be completely refreshed, and when you have a good night's sleep, you don't need any alarm. You don't need any devices to wake you up. You'll wake up nicely. When you wake up, gently stretch your right leg, put your one hand, and get up and sit down. And don't try to get down quickly. You sit down on your side of your bed. Let's get your body physiological changes get balanced, and slowly you get down. And my first thing is sit down in a squatting pose, Malasana, drink a glass of water, and I have a bowel movement. After the bowel movement, I go against the wall and I stand up with the asana, completely straight high up. It's called Tadasana, or your stick pose or a mountain pose. My whole spine is straight. It's a wonderful therapy for your lifestyle related disorders. And finally, we'll be doing next week a pranayama practice for lifestyle related disorders. But just let me show you one pranayama which we practice for our sleep apnea. Sleep apnea people has a local and a central. And generally what happens, the tongue falls down in the back. And it covers your larynx, what is the air is coming through, and person cannot breathe. When you breathe, they wake up. And when they wake up, they create that sense of fear. That fear creates that we call a psychoneuroendocrinology. It activates your limbic system, hypothalamus, and your pituitary adrenal axis and your autonomic nervous system, creates the whole phenomena called metabolic syndrome, truncal obesity, diabetes, hypertension, heart disease, dyslipidemia. When you're able to slowly constrict your larynx, which is supplied by the vagus nerve, superior and inferior laryngeal nerve, which are branches of the vagus nerve. The vagus nerve, your information, 80% is afferent. Afferent means it's going to your brainstem. When it goes to the brainstem, there is all your cranial nerves. The information comes back. First it comes through what we call a glossopharyngeal nerve, the cranial nerve. Glossopharyngeal nerve supplies your soft palate. Two muscles called palatopharyngeus and palatoglossus tightens up. It prevents your snoring. It corrects your snoring. Remember, snoring is a sign of sleep apnea. Before, people say, oh, he's snoring, he's sleeping so well. No, when he's snoring, he's having a sleep apnea. That is the worst thing you can have, because sleep apnea is the root cause for all of our lifestyle-related disorders. See, I've been talking for almost an hour and a half. I still have a lot of saliva in my mouth. Wonderful, wonderful sensation. So, when you slowly constrict, then another symptom comes through your hypoglossal nerve. Hypoglossal nerve supplies your tongue, pushes the tongue in front. Then use a chin lock. When the chin touches your lock, it stimulates the carotid sinuses. And with the left nostril breathing, it is called your Chandra Vidhi Pranayama. It is a cooling parasympathetic activation. Let me show it to you and finish with a therapy for sleep apnea. Sit down with your spine straight. Hands you can do with the Adhi Mudra. This is a very relaxing. Put it on the top. Close your eyes. Breathe out first. Constrict your larynx and try to breathe in. Then slowly drop your chin down. Touch your chin to the chest. And finally, you breathe out through your left nostril. Breathe out first. Take a deep breath in. Completely breathe out. Into a pumping and cupping is another wonderful relaxation response. When you feel the warmth in your hand, put the hands over your eyes. Let the eyes take all the heat from your hand. Massage your forehead, massage your arms, face. Earlobe, back of the ear, front of the ear, inside the ear canal, activate the auricular branch of vagus nerve. Activate, massage, activates your carotid sinuses, massage in the back, the insertion of your trapezius and sternocleidomastoid muscles supplied by your cranial nerves. Thank you. I'm back again. We'll be continuing the Saturday morning classes. Even if I shift my residence, wherever I go, I have my laptop, I'll be able to connect with you. I do have every now and then some technical issues, but we'll overcome, and see you again next Saturday. Thanks for joining this class.